Kenya has today joined the rest of the world in marking the World Transplant Day under the theme Hope for Tomorrow, Transforming Lives Through Organ Donation. The day, promoted by the World Health Organization and the National Transplant Organization, is dedicated to celebrating achievements in the field of organ transplantation, honoring organ donors, and showing support for transplant recipients and their families. Here in Kenya, the Kenyatta National Hospital, in collaboration with the Kenya Tissue and Transplant Institute, Damu, Kenya, and the Ministry of Health, celebrated the event at the KNH, which brought together donors, patients, and medical professionals. Alice Diana attended the celebrations and has filed the following report.
World Transplant Day is marked on June 6th every year to celebrate those who are given a second opportunity at life through the organ donation of selfless individuals. Many people globally are in need of an organ transplant due to genetic conditions such as polycystic kidney disease, cystic fibrosis, or a heart defect. Infections like hepatitis and chronic conditions such as diabetes also cause a person to require a transplant. The Ministry of Health, through Kenya Tissue and Transplant Authority and Kenyatta National Hospital, together with families of recipients of donors, commemorated the day at KNH Hospital with activities including panel discussions, speeches, and testimonials of success stories from both donors and recipients.
My dad devoted himself to be my donor. I truly thank him because, being the only breadwinner in our family, he sacrificed his kidney to save my life. God bless you, my dad.
And the problem was my cornea, which was affected so much. It was more thin, more thick, that it could not comprehend to see, even comprehend the light, because light gives ability to see. So after that, what they recommended to do operation, and I started the progress, and it went well. I registered for the operation, but I requested Lions so that they can do it earlier for me. So because I was going to sit for my KCSE exam, and they gave me opportunity because I'm a student, and I was put in front seat.
The recipients of different body organs highlighted some of the challenges they go through after the transplantation procedure, including high cost of medication.
Once you get a transplant, you need to take medication to suppress your immunity so that your new organ, which your body will recognize as a foreign body, is not rejected by your body. And for you to be, those drugs, you need to take them for life. They're very expensive, and you find that a lot of people, a lot of kidney patients are not able to afford those drugs.
Cornea patients, you have to stick to drugs. Make sure you stick to drugs. The clinics are exhausting. It is very expensive also. You know, I come from Nakuru. I have to be, when the time for clinics is there, I have to come. All the way from Nakuru, you come, you go to the hospital, you go back. It's very expensive and demanding and time-consuming also.
I urge the authorities, the government, NHIF, and all other stakeholders in this space to come up with a way whereby people like myself and all those living with transplants can be assisted so that the new lease of life does not now become another nightmare because of the cost of medication.
Speaking during the celebration at KNH grounds, Dr. Maurice Okwabubi, the Kenya Tissue and Transplant Authority KTTA acting CEO, noted that KTTA is determined to inculcate a donation culture among people to enable them to attain a perpetual annual collection of blood, including organ donations.
Beyond the impact on transplant programs, the availability of blood will greatly impact maternal and child survival, reduce waiting times for Kenyans on dialysis and chemotherapy treatment, and reduce mortality from trauma.
On her part, Dr. Zainab Zura, who represented the PS for Medical Services in the Ministry of Health, Harikim Tai, said the Ministry of Health and Kenya Tissue and Transplant Authority are on course to develop a comprehensive framework of policies and guidelines to ensure quality and ethical practice whilst safeguarding the rights and well-being of both donors and recipients, as well as their families and communities.
Our commitment remains resolute to creating an environment that enforces good governance, supports effective and efficient regulation on on organ donation and transplantation in our country. And this process is participatory. It includes the government, the policymakers, the clinicians, the practitioners, and also the public to make sure that all comments have been taken as we build and strengthen these services.
As Kenya joins the rest of the world in celebrating the World Transplant Day, Kenyans have been urged to be willing donors to those in need in order to save a life. Reporting for Hope TV News Watch at Kenyatta National Hospital in Nairobi County, I'm Alice Diana.